then your setup will be complete. Done. Okay, so I think there has been a link posted already in the chat. That also gives you the instructions and the direct links of where you want to, how you want to sign up. I think you should be able to see this on my screen. No. Give me a second. Okay, so once you have signed up and now you need to activate your institutional license. So if you don't do this, you are going to be limited to the 5-day free trial that is available to everyone, anyone who goes on amboss.com. But now the thing you will want to click is that you want to activate the license of your university. So now you go to the page and it says there's currently no active institutional license. And how you want to add it, you click on this button that says Add New License. You select which university that you are from, which is Universitas Negeri Malang Campus Access. And you click Next after that. And they will ask you for your official university or clinic email address. So that's how they verify that you are a student or you are a faculty of Universitas Negeri Malang. And so after that, they will send you an email for you to activate your account to confirm that this email is correct. I can't do this now because I don't have this official university email, but after that, you will have your account activated and it should write on your profile. So if you want to check to make sure that it's activated, you can go on this left sidebar to under Accounts and Settings, and you can click Membership and Licenses just to check your current membership and licenses that are active. And currently I have neither active, but this should have your university name after you have activated the license. I hope that that is useful. We've gone to the first step. If there are any questions, we can address them right now, either in the chat, or if we're okay to move on to the features of Amboss, then we can give a thumbs up, just so I know everyone is okay.
Yeah, I think you can continue to the next step. I think you can continue to the next step.
Okay, perfect. So now I will share my screen on how your Amboss dashboard should look like. So this is after you have signed in and you have set up your profile already. This is how it should look like. Like I mentioned, you can also interchangeably change your study objectives and your university. So you are not limited to just one thing. This is under Philippines now because I've just completed a session with them. So this is what it would look like for you. There you go. And I will save these changes. Okay, so now that that is done, my profile is set to medical student. I would like to go through 3 of the main product fundamentals, especially for students, and how they can utilize this to the best of their ability. So the first one is the knowledge library, which is where we have preclinical and clinical content from all disciplines and specialties, and it's organized in the form of peer review articles. I think we have about 2,000 of these, and every month we have constant updates to make sure that the information that you're receiving is up to date, is clear in case any guidelines have changed, and we'll be able to see all of these updates. I think just in case for the faculty and the educators, they want to make sure that what they're teaching and what's available online is accurate. So we'll go to the knowledge library first and how you want to access the knowledge library. There's 2 ways to do this, okay? So first way is to go to this library section on the left-hand side and you click on articles and you can see all of our big subtopics. It goes from basic sciences to clinical knowledge, and even up to the on-call survival guide. So these are the bigger main topics. For preclinical, let's say, we would click on basic sciences, and then we would look at disciplines, and now we can see it's divided by the preclinical subjects. So from anatomy, biochemistry, physiology, and the like. These are very, very core, I think, preclinical science articles. So for example, we can go through a few features that are helpful for the new students, especially. I think the first years who are just coming in, who are just learning anatomy for the first time. This is a function that is helpful for them when they learn, especially when they're learning something new like this. So these are the diagrams that you see in terms of anatomy and how you want to test yourself. Is we have this quiz available where they can ask you which of the following is marked in this image here. So here you can click on what's correct, what's incorrect. This is quite an interactive way of learning rather than, I think traditionally students like to look at a picture and then they close the labels and then they try to memorize it from there. But now you do have this quiz that also helps you do all of this kind of automatically and not having to do it manually. It's a bit more time saving. So these are the quizzes. I think I will go back to the articles. As I mentioned, it's divided into two ways. You can click on the topic based on disciplines or even based on the rotations that you have from medicine, surgery, the main two branches. You can see from medicine, it goes down to different branches of medicine. And even in each branch, there are further branches, subtopics. So that is how you access the articles. The second way you can do this is that you can straight away utilize the search bar up here. So it says ask a medical question. You can use it like you use your Google, your ChatGPT. And so let's say I'm typing in pneumonia, just a keyword. What would come up, number one, is the articles, the main article on pneumonia. We have a few AI summaries here. And we also have just some articles, sub-articles such as pneumonia in children and the like. But we want to focus on the main pneumonia topic as I show you how a typical Amboss article looks like. Okay, so this is what we call an article. You can think of any condition or any subtopic, any procedure as well that's commonly tested in medical schools. You would have an article on Amboss regarding it. So with Amboss articles, you can see it's divided into different subtopics, so it's quite structured. We start from summary all the way up to the management as well, and you can expand all of this. So this is the article in its full. It's very, very long because it's quite a comprehensive topic. You can collapse it unless you just want to view the clinical features, let's say. And you also have the options to view it in different modes. So what this means is that standard is how the article looks like in its original unmodified version. And for clinicians, let's say you are a clinician, you may want something that's more clinically relevant as in medication dosages and the like. They will show you a bit more. So that would be the clinician mode. You can click on high yield. This is especially good for students because it shows you whatever is relevant to your. Sorry. I think everyone who's joining, if you could please mute your mics, that would be great. Again, as we are going for the articles, here is what you would see. High yield, which is things that are commonly tested in exams. So we'll go back to standard view. And there's also this button that you notice, which is key exam info. So this will automatically highlight things that are most tested based on your study objective. And when I highlight that on, you can see this is already something that is automatically done. Unfortunately, this is all important. But yes, so if we see the clinical features, these are all highlighted as key exam info. If you click on high yield, you can see it becomes a little bit shorter and condensed. So here are different ways that you can use the article. What you can also do is that you can just use your own highlighting tool. Let's say you want to highlight something, and that will automatically do that for you. So that's my own personal highlight. This is based on your own studying, so everybody's Amboss articles would look different from one another. Okay, so now that we've gone through, this is the articles. We have a lot of multimedia to also support students' learning. So it's not just reading. I think it's a very effective way of learning. We also have different videos, more short bite content videos. This is about 9 minutes long, but most of our videos are a bit more shorter because we know that we want to get all the explanations straight to the point instead of, being a little bit more draggy and too heavy content-wise. We have supported with images that you can see to also help your learning. This is an image of a process. And what you notice is that all the words here, or mostly the words here, they are underlined. And you might be wondering why it is underlined. So these are what we called the summaries. So let's say a student is reading a topic. They're learning about pneumonia, which is maybe something new for them. And they go through a word that they don't understand. Maybe they are seeing this word dysphagia. Um, Probably they haven't covered the topic yet, and so by clicking on the hyperlink, you can see that they give you a short summary of the word that you are clicking on, and you can also view a separate article on the specific word in a split view. So if I didn't understand dysphagia, I can click on the article and I would straight away go to the main article on dysphagia in case I wanted to read more about it. But it also helped me focus back on the main topic that I was studying, which was pneumonia. So it also helps students kind of stay focused and not too distracted when they're jumping within topics, within one topic and another. Maybe another example I'd like to show. Here are some. Here we go. Okay, so a lot of words here. Let's say you want to look at tuberculosis and you click on this, and again, they give you that summary of what tuberculosis is. And if you want to read more on tuberculosis, you can click on the split view. And there you go. This is the main article on tuberculosis. So it's quite an interactive feature. It's also something that you can do while using the app itself. So a few things that you might have also seen is that this is an example of a histology slide. So this is a lung tissue specimen, something that is typical for students to read and learn, especially when they're in their preclinical years. And typically what you would see in the lecture notes or in textbooks is a picture that is quite static, and you have the description at the side, but students won't necessarily understand what they're trying to look at, especially if it's the first time they're seeing it. So, especially when they're studying alone, a helpful tool that Amboss has is the overlay function. So, you can see that this is the specimen, and they're giving you the description of what you have to look at. But when you click overlay, they clearly highlight the features that you're supposed to focus and pay attention to, rather than trying to go through the whole specimen looking for the correct answer. So it gives them a sense of assurance that what they're reading, what they're learning is correct and they are on track. So we have a lot of specimens based on different pathologies available on Amboss. And we also have this smart zoom feature for histology. You can see that this is a specimen, and what I can do with this is that I can zoom in as much as I can to clearly look at the cell. So this is as far as it goes, I think, but it's quite clear, you can see. And with this, they also have different labels that tell you exactly what you're supposed to look at. Here is the label, the different labels, and the different structures of the specimen. And we also have these overlays here. So this is the area. You can move it around as you please. So this is what we call our histology smart zoom feature. So this is an example of lobar pneumonia and the histological findings within it. Here is another example. It's another tissue specimen, but with the overlays, it will show you exactly where you're supposed to look at. Okay, so now we're still back on the article for pneumonia. Here we're back to clinical features. We also have videos to support not just the theoretical learning of pneumonia, but also the practical skills as well, which I think you would have the OSCE exams. Here is an example of a clinical examination of the lungs, along with the findings that are usual. So students can watch this on their own time, and these are all produced in-house in Amboss. Okay, so now we're down to lab studies. You can see that it's quite structured. It goes really from the main summary up to now we're at lab studies, and then we will go to management after that. And here is another exciting feature for Amboss articles, where we have a lot of radiological specimens. And X-rays is such a huge part of medical school, I think, especially in medicine and surgery and the like. So for students who are still learning this and they're just starting out, they would need a lot of practice. It does take a lot of practice to know what is the normal pathology, what is abnormal, and right now you're looking at the X-ray. You have the description on this side as well. And we do have now also the help of overlays. So now with overlays, you can see, okay, this is what I'm supposed to look at based on the condition of pneumonia. So a few other examples. Another example of an X-ray. With the overlays, they will show you and point out exactly where to look at. So with self-studying, again, you don't have the privilege of a specialist being next to you to explain where to look at. This is helpful for them when they're studying on their own. So besides the X-rays, we also have CT scans, ultrasounds, everything that's available there. A lot again with the different overlays here. You can see that there are 4 different types of findings that you need to look at or point out, and you can see that they are labeled based on their color and their description at the side here. Here is another example. This is the ultrasound, and you can click on this, and here you go. This is the overlays that you're supposed to look at. All right, so almost towards the end of the articles. For clinical students, maybe they're not present today, but for clinical students, we do have the clinical calculator as well that is especially helpful in bedside teaching. So this is a typical score that we know is to help the pneumonia risk stratification to decide what management for the patient. And of course, they would have to learn and memorize these scores for exams, but for the use of also just bedside teaching, this kind of helps speed in the process. And you just fill in the details based on the patient or the mock patient that you're seeing, and they will automatically give you the score, the mortality, and the suggested triage for what you should do with this patient. Okay. Now we're down to treatment. This is a flowchart. Again, we have pictures, diagrams, videos to support the students' learning. So it's not just reading from the textbook per se. And then when we end, now we're down to complications. And what I like to also say for students is that sometimes, of course, there are differences in local guidelines as well, in terms of management, even differences within different hospitals based on the availability of medication and the like. So one thing that all students can do is that when they're reading this and they want to add their own personal notes so that they know and they take note of this, they can click on this notes feature and they can freely type their own feedback. So let's say use medication, use medication XYZ for XYZ. And when they save it, they will always have this note that they can refer to every time they are studying pneumonia. So it's only visible to them. Not everyone is able to see this, but it helps remind them that even if you have content in Amboss, there are additional specific details that you need to learn that is based on what your lecturers are teaching you. So lastly, every article that we have the references of where we source this information from. You can see all of the articles. We have 47 references here since it's quite a big topic, but I understand that knowing what is clinically relevant and accurate is quite important. And when we go back up, you can see that this article specifically has been last edited on the 5th of May 2025. So it was only a few months ago, meaning that it's quite up to date rather than sometimes we have some journals that may be a bit outdated because of like how quick medicine moves as a field. So I think we have gone through most, if not all, the features of an Amboss articles. Maybe I'll go through the questions first on Zoom to see if there are any from the students and from the faculty as well. Okay, I believe that was also a question regarding the references. As I mentioned, every article has the references at the end. We also have this link to our content policy, of how an article is created because it has quite a tough and rigorous process of vetting. We want to make sure that the information that we're putting out in public is accurate. It's quite a lengthy detail here, but basically it shows you the number of layers of approval you have to go through after every information is updated. Here are some of the sources that we draw from, but this is not exhaustive. It's just some of the main ones that we refer to. For example, more emergency medicine topics such as sepsis, they use international guidelines. So this wouldn't really differ from country to country. Okay, so we have covered the first part of what Amboss can do for you, which is the knowledge library. Again, if there are any questions, you can raise up your hand, you can ask a question in the chat. Just want to make sure that everybody doesn't have any doubts before we move on to the second aspect of Amboss, which is the question bank. Okay, it seems like no questions. I think everybody understands it well. Thank you very much for your response. Now I'll move on to the second big function of Amboss, which is our question bank. So going back to my account, so this is back home, and just now we went through the library, and now we're going to go to the question bank. So what students can do is that they can either create their own custom question bank session, or as we went through the previous article there, we just studied pneumonia, and we want to do question bank on pneumonia itself. That's how you can tie in the articles with the type of questions that you want to do, your practice questions. But you can also just create a custom session where you're able to customize what you want to do, what you want to test yourself on. So it starts with writing a title. Maybe you just want to write is a custom session. We have a lot of filters. You can see that even if I remove all the filters now. So this was the previous filters that I had from my other demo I did earlier. And so I'm removing them. And you can see our total questions right now is 15,000 questions, which is quite enough, I think, for students to get through in their 5 and 6 years of learning. And this is also being constantly added on as the days go by. So first thing I would filter out is for the exam. You want to know, are you sitting for a basic science exam that's just testing like your anatomy, your histology? Are you sitting for your shelf exam based on the clinical rotations that you have? Because if you notice, we have also this NEJM Knowledge Plus as we have acquired them. And so we have the question bank for board exams, and these are specialist exams. So we do not recommend that students have this filter on because they are quite tough. I mean, you can if you want to challenge yourself as well, but for the current students level, it would maybe be under the USMLE, either step 1 or step 2. That's quite the level, the standard level of medical school questions, and the basic and clinical shelf exams here. So let's say I want to do a question regarding anatomy and embryology. I will put that first filter in. You can filter by systems as well. Let's say I want to test myself regarding anatomy of musculoskeletal system. We'll put that in. So the more filters that you have, it will get reduced, the amount of questions available. So with all the filters we have 46 questions now. You can also filter it by different specific symptoms or even specific discipline, even specific articles. So let's say you just learned about abdominal hernias, then that is something that you can include in the filter as well. But I will remove this for now. And another thing you can filter it from is by the saved questions. So for those who go through the Amboss questions, sometimes you have questions that you think are good, or you want to repeat it, or you want to group it into a little folder. You can also create your own folder based on the questions that you have done before. You can filter it by difficulty. So 1 hammer is the easiest, and 5 hammers is the most difficult here. It's the last one. But we recommend, if you're just learning a new topic, you maybe choose maybe 1 or 2 hammers just so you're used to the content first before jumping on a bit of the tougher questions. There's also a question for filters for statuses. Maybe you have done half questions and you want to only do questions that you have not yet answered, or maybe you want to repeat the questions that you have answered incorrectly, you want to test yourself again. That's also one of the options, but you can either click all, one, or none, customize this however you would like. You have the option of mark questions only and the questions with images only as well. You can turn that on if you would like. And now you can see after we've put in all the filters, we have about 19 questions available. So maybe I'll put just 3 questions for today. And you can see that there are 2 different types. You have the study mode and you have the exam mode. And these 2 modes are very different in the layout and how the questions are presented, but we'll go through them today. So we'll start doing the study mode questions now. So after you have created your own custom session, here is how an Amboss question looks like. It's a clinical vignette question, so there's always a patient. You can always see the patient demographic, their presenting complaint, and I will just highlight this as how a student would when they are reading this question. So the presenting complaint is knee pain and swelling 30 minutes earlier while she was at soccer practice. So students can highlight this as they read the question. And what you notice in study mode that you have a few additional features. The first one being the key info. So key info helps you underline the information that is important to answer the question, because as we know, sometimes in MCQ questions, especially, there are a lot of information and not all of them might be relevant. So if you need a bit of help to underline the important features, you'll click on this and they will automatically highlight this for you on what you should pay attention to in order to answer the question. If they feel that, the students feel that it's still a bit hard, they need a bit more help, we have this other button called attending tip that gives you an extra hint towards the correct answer. So it's kind of like having a doctor next to you to give you a bit more extra hint. And this kind of scaffolding helps students remember these facts better when they are going to do this question or test it on this knowledge the second time around. So they're giving you the hint here, which should help you answer the question. And another thing you can do is that you can, as I mentioned, save the questions in your own folder. You can create a new folder if you would like. That's just for future reference. And now we'll try answering the question. And you can see it's yellow, which means it is correct. And the reason why it's yellow and not green is because we use the hints that were available to us previously. So it's not like something that we are 100% confident in. It's something that we need a bit more help with, which is okay, but it helps you also understand your own studying patterns and your strengths and weaknesses in what topics. So every question that you click that's correct, so this is the correct answer, they will give you an explanation of why it's correct. They will support with some diagrams, some pictures are relevant to the question. And if you want to read more about the specific topic, you can click on the article that is linked below here. So now you can see they show you exactly where to look at in the other article, so you don't have to scroll and find and waste your time a little bit trying to look for this specific piece of information. So again, what you have similar to the articles is that you also have these hyperlinks that show you the summary. Let's say you don't know what an unhappy triad is, and you want to read more about it. And here's a summary of what it is. And if you want to view it, it shows you exactly where to look at in the separate article. So if you get it correct, you get an explanation. If you also get it incorrect, you get an explanation too, because we want students to not only just do questions and try to aim for higher scores without really understanding the principle and the reasoning behind it. So that's why this mode is called the study mode. So it helps you with your learning in a more active way rather than just reading and not really putting that application of knowledge into practice. So here is another example of a question. We will just answer this as we go. So here is the correct answer. And here is our last question. And after every question bank that you do, every session that you finish, you have this analysis. So it shows you the amount of questions you have done, your percentage, whether it's correct, and how much time you spend per question. So this is important because time crunch is like a big factor on how students perform in exams. Sometimes they are very knowledgeable, they have all the knowledge, but if they can't really stick to a time frame in answering these questions, there might be an issue and you might get a bit stressed. So with this, you can train yourself to also, spend shorter time each question as you go along because it's really all about practice. And it's like test taking is a skill that you build over time as well. It's not just, reading and knowing the information. So based on the questions that I've done, this session itself, they will give me recommendations of what articles that I should read. So I got this question wrong, which means I should study more on peripheral nerve injuries and the like. So it also helps you focus on knowing what topics you're good at, what topics that you are a little bit weaker in. Maybe you need to spend more time reading and understanding that topic rather than a concept that you are quite well versed in. So just now we have seen how the question bank looks like when it's in study mode. Maybe I'll show you how it looks like in exam mode, just so you can see the difference. But with exam mode, it is quite literally like simulating an exam. So here it is. It looks a bit different visually. You can still highlight the question if you would like as you go along. Um, but if you notice, there's no key info, there's no attending tip, and even when you answer, they won't tell you if you're right or wrong, if you understand this question or not. You only know the answers after you finish your session. So hold on. You have the timer here as well to help you time yourself. It's kind of like really sitting in an exam. And after that, I end my block and they will give you the same session analysis. And that's when you can view what questions you got correct, which questions you got incorrect, and what you should study more, basically your study recommendations. So we have gone through the second feature, which is the question bank. So question bank, again, it's not 12,000, sorry, this is outdated. It's 15,000 case-based questions covering both preclinical and clinical subjects. You can use the filters however you would like to fit your type of learning. So maybe I'll pause here for a while just to see if the students or the faculty have any questions regarding our question bank. And then we can move on to the last part, which is the analysis tools. Okay, so far there are no questions. So I think I've explained it pretty well if there are no questions. Again, these are only three of the main features of Amboss. There are a lot more which you can explore in your own time. But now we'll move on to the third product fundamental, which is analysis tools. So we've kind of covered a little bit about it just now when we looked at the analysis for every question bank that we finish. So you can see that, here is your stats, the articles that you should study, and this is just based on your session, that question bank that you do. However, you can also view your entire study summary, meaning everything that you've done on Amboss, all the different question banks that you've had, your sessions. This is your overall statistic. This one is not very good because it's my test account. So very poor results here. And then it gives you what percentile you're at, how many questions you've done, and how much time that you spend per question as well. So based on everything that you've done on Amboss, all the question taking and answering, you have your overall study recommendations that show you what articles you should revise more on. So this is your top 7 articles. You can expand this to however more you would like. It goes quite on and on. Maybe you can see what disciplines that you need to work a little bit harder on. So mine is family medicine at number one. And also, if you want to see different systems and what you should improve on, number one for me is the nervous system and special senses. So this is my first priority based on all the questions I've done. I'm very poor in this subject. So this kind of reflects my personal performance as well when I was back in medical school. So here is the overall general study summary and analysis. So everyone's study summary and analysis would look different based on how much activity you do on Amboss, how much time you spend per question. So that's why we encourage you to use your own account and do as much reading of articles and question banks as possible. So lastly, we also have the study plans that is available for students. So we have a lot of study plans that are already pre-created, which means these are like specific bundles. Here is one for biostats and EPID. If you have your clerkship exams, your clinical exams, here is already one pre-created for you, so you don't have to really spend time in creating a new one. But you can also create your own study plan, which is how we do about here. So when I want to create a study plan, the first thing that they would ask is, what exactly are you studying for? Are you studying for a certain licensing exam, or are you studying for your clinical rotations exam? This might be for clinical students, or you're studying just specific pathology. So yeah, you can filter this out first. You can put general basic science exams. So this really depends on what exams that you are taking soon. Maybe I'll put biochemistry for the purposes of this session. And it tells you, asks you when you want to finish studying. So if I have my exam in like 2 months' time, and I want to finish studying by the 1st November 2025, and I want to do a quiz on questions that I have not answered or that I answered incorrectly. So the study plans is really anchored in the question bank to make sure that you learn the topics and principles behind each question that you answer. So based on that, they have automatically calculated I need to study for 1 hour for 3 days a week to finish my plan by my end set date. Maybe I want to study more hours in a day. So I can include this. Maybe every day I want to study 3 hours. So I can lessen the amount of days that I study. Maybe I study 3 hours a day, but I want to study on the weekends. So with this study routine, they'll tell you when you'll finish. So I'll finish by the 5th of October. So that's way ahead of my exams. It's coming in a month. And with that, I will click Create Plan, and they'll automatically have a study plan that is personalized to you only. So you can see it divided by different weeks, week 1, week 2, week 3, week 4, and here is the progress bar to show you exactly where you're at with your study plan. Okay, so we have covered all three product fundamentals. The first one being the articles, the knowledge library, where you would kind of learn the content first. And there's a rapid acquisition and application of knowledge. And then you go into question bank to also test yourself on whether you know how to apply what you have learned from the knowledge library. And lastly is the analysis and study plans that help you really manage your time better in knowing how to plan your next course of action, whether you have an exam coming up or you want to be prepared ahead of time. So these are the three main product fundamentals. There are a few more additional features that I will get into, but for now, I'd like to pause to ask if there are any questions from the floor, either from students or from faculty.
Okay, thank you, Aisha. Uh, please, my student, my medical student, whether this is the medical student or maybe nursing student, or also the midwifery student, maybe if question, because actually we have already used this Amboss, yeah, but maybe not quite often yet, and
Mhm.
not quite uh, uh, Yeah, yeah, okay. Not that often lah, yeah. We just only open in this maybe like in this moment when we have training for the using Amboss, or maybe uh, if our students are going to have a examination, they will open the Amboss, but we still trying to keep the motivation to our students to more often open the Amboss and using the Amboss for the studying resources. Is there any suggestion from you, Aisha, how to motivate our students so they can so they they will, yeah, so they will open this Amboss more frequent.
Okay, thank you, Pak Arianto. So this is a common question that I actually get from a lot of lecturers as well, and I think it's a very valid question. So you mentioned that, you have nursing students as well using Amboss. Um, Sidetrack, I will explain on nursing first before I get into the answer of that question. So,
Okay.
a lot of people think that AMBOSS is just for medical students, but we have actually changed our mission plan from not just medical students, but also for all medical professionals. So, we are expanding this into nursing, into, pembantu kesehatan. I don't know if that is a
Okay.
role that is available in
Public
Indonesia.
health maybe.
Yeah,
Public
pegawai
health
kesehatan.
maybe.
Yeah, public health as
Yeah.
well. So for them, you have a few things that are relevant for nurses, especially would be the on-call survival guide, because this goes through, let's say, the clear management guidelines of tachycardia. Or we'll go to another one actually. Maybe we'll go through sepsis, a very common question that nurses and doctors would have to know. We have this quick guide that shows you exactly how to approach. There is a checklist, there are red flags to look out for, the management checklist and what to do next. And so this is something that is helpful for students, for our nursing students as well. And for our question banks, maybe study plans. We'll go to study plans. If we look at here, PA exam prep. So PA exam is a course, a study plan that is specific for physician assistants. It's a role in America, but it is also in the same level as nursing courses, degrees in other countries. I cannot find this because I think I have already created a study plan on its own, but here is. Yep. So here is, I think this is the PA study plan, but this is useful for nursing as well. So this is just a sidetrack on how you can find these features because it's not just for medical students. We also have dentistry students using Amboss as well, and they find it helpful. Okay, and back to the question of how we want to motivate students to use Amboss. I think a lot of this comes from number one, the hassle or like the barrier of understanding, because it is a digital product. You have to also know what you can find there, how you can use it more effectively. So if you think that, oh, okay, it's too much work, I don't want to have to, learn how to use Amboss when I have already so many books to look at. I don't have time to do this. That barrier of learning, for sure, that is a bit of a learning curve. But we find that with adequate training with students, when they actually realize that, oh, I do have this on Amboss, it shows that, it can be a one-stop platform if you know how to use it. And the way we do this actually is that we run workshops with students. Personally, myself and Dr. Fida on this call as well, we visit a lot of universities, especially those who we have licenses with, to not just train them, because this is like the first training where they get to learn the basics of Amboss. But for the more money features, we run clinical workshops where we teach them how to do history taking, physical examination. We have quizzes, online webinars as well, that is a lot more educational based. So instead of saying this session is for you to learn how to use Amboss, it's more like this session is for you to learn. But then we'll show you also how to use Amboss at the side. So showing students that, these specific functions are available gets them more interested and more motivated to use Amboss. So some lecturers, they like to use their more interactive functions to show that you can actually do this at home. We don't have to do this just in class. And for example, maybe I will show a lesser known feature of Amboss, which is our 3D anatomy. So a lot of lecturers use this in their learning, their teaching, sorry. And when students are able to see it and they don't know that they actually have access to this, they think Amboss is just like an online library without interactive tools. Here is our interactive 3D anatomy model for the upper extremity. So you can zoom in to the specific structure, you can move it around, you can really play around with however you'd like, especially for first years who are just learning anatomy. This is available to them. I'm moving it around, and it's if I want to isolate certain structures. So there's a lot going on here. Maybe I just want the muscles and the ligaments to be visible. I don't want to see the nerves and the arteries yet. So here is how it looks like. So this is just the muscles and ligaments. They can really view different things. And it's just a more interactive way of learning rather than looking at static pictures or even during dissection labs, they don't exactly look this way anymore. So these are smaller features that students don't know exist. And so with them knowing that exists and with proper training and workshops, then we're able to hopefully increase the usage and get students a bit more excited because they are not too scared to approach it. They think it's like the super high-tech thing. But I think students are using ChatGPT now. Students are using all these different functions when they're not aware that they already have this in their hands with Amboss. Sorry, it's a very long-winded answer, but essentially it's getting students to know exactly what they can find on Amboss, training them how to use it, and running regular workshops. That's one way that we find helps for students. And even as a lecturer, if you want students to go through a clinical case or you have your problem-based learning sessions, you have specific articles that they can look at. Here is some cases on, let's say, abdominal pain. So like we mentioned, they will give you an opening scenario of a female, their vitals, they'll give you instructions. So this is something that they can simulate and use when they are studying with their friends, when they are practicing for their practical examinations, and they can like test themselves as well. So very much a lot of hidden features. So I guess for them knowing this is essential to them actually using this to see how they can benefit from Amboss. I hope that answered the question, or if you have any follow-ups, Pak Arianto?
Yeah. Okay, thank you, Aisha. It is interesting, especially with the 3D anatomy and
Yeah,
maybe the other features I don't know, maybe the video or maybe the other, because so far as my student knew that Amboss is just like an online library, just, just limited only in online library. But yeah, maybe this feature with the 3D animation and then the videos, it helps our students to be more interesting to access the Amboss. Yeah. So they can not just only using the AI or ChatGPT, because sometimes AI and ChatGPT they didn't use the good reference. Yeah.
yeah,
They just take randomly from the online resources, but through Amboss we can also look for the main resources, yeah, for the reference. Yeah, I think it's good for
yeah.
our students.
And
Maybe my
regarding the
student,
ChatGPT,
mahasiswa, yeah,
sorry,
yeah, sorry,
regarding
sorry.
ChatGPT as well, we do have an additional feature which I will explain later. It is in my slides later, I will show. But for just the main product fundamentals, maybe we'll open the questions to any students or any other faculty that want to ask questions.
Okay, please, my student, I can see medical, and also our nursing lectures to attend this forum.
Yeah, that can be
Please,
done.
yeah, my student or my colleagues in Malang, maybe you have any question?
No questions? So if we can move on, but also a reminder to students or maybe who came a bit later, if you have any questions, if you want to speak in bahasa Indonesia, gua bisa ngomong bahasa Indonesia dikit-dikit. Jadi jika mau tanyain dalam bahasa Indonesia bisa paham.
Boleh
Um,
lah, boleh lah.
boleh lah, boleh. Okay, so we have
Luar.
one question here. What is the main difference between student and clinician mode? Okay, so good question. We shall go through it. So here is the two different modes. So you can change this interchangeably, whether you are a student or you are a faculty. You can either do more learning in student mode, which is focused on exam prep, or you can practice in clinician mode, which is more for clinical care. For those who are already practicing, I'll click on that. So you can see that with clinician mode, it looks a bit different. You have a separate sidebar on just drugs itself, because that is what majority of your day-to-day work will revolve around. You have more clinical resources where you have quick guides and checklists for how to manage a patient. So these are definitely a lot more relevant for those who are already in their intern year, or who are going into intern year and they want to study a little bit, but it's not really that helpful for students who are still in their learning phase, where they are still kind of building that foundational knowledge on, the pathophysiology and the management behind a disease. But all students and all lecturers can switch between these two modes interchangeably. It's not just like you're a student, you can only view the student mode. It's not like that. You're able to view all of Amboss because the university already has a subscription to Amboss for students. So I hope that has answered your question. If there are any follow-ups, all right, that's good that everything is answered. Again, any other questions from the floor?
Yeah, I think you can continue. I shall to your next.
Okay, great. So now we will go through, these are things that I just like to highlight again that is relevant for students, which we have the anatomy features just now, the quizzes, but also the 3D models. We have the histology features where you can zoom in, zoom out of the specimen and the slides. We have physiological training as well for those who need to learn about the processes and the mechanisms between like a cell and how a certain disease manifests. So these are kind of the foundational things that are relevant for preclinical students. Here is the example that I showed just now regarding the anatomy quiz. So it can be interactive. It doesn't have to be sitting down and reading. And, it's not just in the library. We have so many other tools inside Amboss that you can explore in your own time. Here is another example of the 3D anatomy that you can use for your studying, for those who are going through the anatomy topics subjects right now. And we also have the slide box with the overlays that really point out what you're supposed to look at. And it's really helpful for when you don't have the privilege of, your lecturer next to you at all times. So yeah, these again, highlighting all the different functions that I've already shown and spoken about. This is the one that is relevant for clinical students. So knowing how to read X-rays with the overlays here, knowing how to look at the different pathologies in different samples and the clinical calculators as well. Okay, so lastly, I know we mentioned ChatGPT just now. So we have two integrations. We have a few more integrations, but these are the two main ones where there are some students, I think, who use Anki already. If you don't already know what Anki is, it is a separate flashcard software that students use to answer questions in a spaced repetition kind of principle. And you do like 50 questions, 100 questions a day. That helps you practice how to answer questions quickly. It helps with active recall for you to remember things a bit more effectively. And with our Anki integration, you can integrate Amboss into your Anki cards, your existing flashcards, so that when you answer the question, you also have the Amboss library next to you that you can refer to whenever you see a word or terminology you don't understand, or you want to refer to an article to read more in-depth functions between it. So lastly, I think ChatGPT is something that a lot of students already use in their daily lives. But as Payanto said, you don't really know where this information is sourced from. It's taken from all over the internet, and most likely it is not medically accurate. Even if it is, it could be outdated. And so we know that this is a big issue within, the medical education field. And without integration, you can use ChatGPT however you would like, but the information is sourced from the Amboss library only. So they're only taking information from Amboss library and not from the whole internet. So if you have access to Amboss, you would already have access to this. It is given for free to students, and I will show you how to access it. Give me a second. Okay. So here is ChatGPT and how your ChatGPT would look like. So you click on this button at the left that says GPTs, and you search up Amboss. So I already have it installed in mine, but you can just search it up here. And you click on Amboss, and you can start chat automatically. So this is the Amboss GPT. You can use it how you would use it if you were a student asking ChatGPT, but you know that you can trust this information a bit more because you know it's sourced from the Amboss library and not the entire internet or a search engine. Here are some examples of what you can ask. This is an example that I'm just going to click on. So I've asked them to define unstable angina. It's taking a while to load, unfortunately, so we need to give it a few minutes.
Sometimes it disconnects. Maybe that is the reason. If you
Yeah.
go back to GPTs, it might reset, unfortunately. Yeah.
Okay, I think my internet connection might be an issue here. But as we wait, a bit of context about how you can use Amboss GPT. Students use it to ask questions, medical questions, any case-based questions, you can use it. But there are also some students who are more creative and they want to use Amboss GPT to help them plan their studies. So a typical prompt they would use is that they would say that they have an exam coming up in a few weeks' time. They want to cover this amount of knowledge, and because you are linked to the Amboss GPT, don't know why it's not loading. Because you're linked to the Amboss GPT, it will help link it straight away to the articles that we have on Amboss. So it will show exactly what article you should read, how long you would take to do this. It will draft up a whole study plan for you. And I wish I could show this right now, but for some reason, it is not loading. Yeah. So what happens when you click on Amboss GPT is that first you start chat, you can ask a question. Still not loading. I don't know what's wrong with my internet. But when you ask the question, they will ask you to log into your Amboss account to make sure that the account is plugged in, so they can source it from your account to Amboss. And then they will show you the answer and they will show you the related articles that you can refer to if you want to read a little bit more information. It's available to you there. Yep, I think there might be some issues. Maybe Fadan, would you have this loaded on you right now?
Let me try. It might be a connection issue, so hopefully my internet will do better. I'll share my screen if that's okay. Okay. Let's see if mine works better. GPTs, Amboss GPT. I already have it loaded. It's the one here. I'll go with differentiate TIA from stroke. Yeah, mine seems to be loading. It's probably the internet problem. You do need to be signed in to your Amboss account. So now it's asking me to sign in to Amboss. So your regular Amboss information. I will now click through my Google account because I have Google linked to it through work. And now it'll come back to ChatGPT and answer the question I just asked. Great. So now it's talking to Amboss. So you know that the information is coming from a reliable resource. All the information here is based on Amboss information only. So it is not hallucinated by ChatGPT. You can trust this, and it also shows you the specific areas in Amboss that this information comes from, allowing you to go ahead and go to the article and get the information and check the references and be very sure of what actually you are learning and teaching. So for example, there's a reference here. I can click it. This is the reference. Reference there, I can click it. That's the reference, etc. And it is all provided.
All right. Thank you so much, Fidan. Anything you'd like to add? Sorry.
No worries at all. Yeah, like in general, I'll open my video as well. Sorry, in general, we try to be as interactive and as useful for the students as possible. As Dr. Aisha demonstrated, we have tons of different ways to study. I used to, for example, like to listen to music when I'm studying. So I would not watch videos, but I would use the high yield mode. I would use the 3D anatomy, smart zoom, ChatGPT. Well, we didn't have ChatGPT in my time, but other tools that I can study with while listening to my music. My friends only learn when someone is speaking to them, so they love the videos. Another student will love the flashcards. We try to fit everyone's learning styles just so every student can find what they need in Amboss. I think that we've tried to demonstrate a lot today, but we do have more. So go dig in, go all through the library, try to see different aspects of the platform, and I'm sure that every one of the students will be able to find something that will help themselves.
Thank you, Fidan. We have one question in the chat that asks, how does Amboss use data analytics to help students identify their learning gaps and track their progress?
Should I
Sorry.
answer? If
Yeah,
you like?
would you like to?
Yeah.
Not sure if it's
So-
on the faculty side or the student side.
So on the student side, I'll share my screen again. So on the student side, what we do is, as a student, so I'll go back into the student mode. As a student, what I will do is I will go into some articles and I will read, right? So let's say I'm in the library. I'll go to any particular topic, clinical knowledge, or basic sciences. So I'm a younger student. I'll go by system, gastrointestinal system, gastrointestinal tract. So I have an article and I'm reading this article. I can read and I can solve questions and I can study everything, take notes, go through 3D anatomy, etc. After I finish my reading, at the top, you see this little bar here. This bar represents the questions that we have about this particular article. So gastrointestinal tract in terms of basic sciences, in terms of its histology and anatomy. This, the part that is filled is the number of questions that I have seen. So I have seen only one of the questions. There are 7 questions about this particular page, and I got that one incorrect. So I can go here now to the QBank session and get the questions. There's 9 apparently. So get the questions that I haven't seen. So I will start. And now, as I answer these questions, I will give some answers here randomly, and I'm getting some incorrects, maybe some correct. At the end, what's going to happen is this article will change based on the specific incorrect answers that I am giving. So Amboss analyzes to understand what I am getting correct and what I'm getting incorrect. So now we have this extra information. I got 1 correct, 8 incorrect. This was the article we just came from. So here, as you can see, the statistics changed. It used to be just a little bit of red. Now it is a little green, the rest of it red. This means I've seen every question and I've performed correctly at this percentage. Now this button here, the key exam button, when you turn this on, it does 2 things. It gives you a yellow highlight based on the goal that you have. This can be anatomy, physiology, internal medicine, emergency medicine. The highlights change based on what my goal is. So for this, I had USMLE because I was doing a different presentation, but I can choose anatomy and it will show something else. The second thing that it does, I will scroll down and show you, based on the specific mistakes that I made. So for each of your students, they make different mistakes when they're solving questions. There are red underlines here. I don't know if it's very visible because of the highlight. So there's a red underline here with Brunner glands. Maybe there's more visible ones. So this function adds red underlines to mistakes that this particular person, so the mistakes that I made. The goal here, so you can see it here a little better. So increasing gastric motility with ghrelin, neuropeptide Y release increase. So this is the specific data analysis that is individual. The yellow highlights are same for everyone with the same goal. Every student with the goal of anatomy will see the same highlight, but they will only see the red underlines based on their own performance. And then when they go after this, if they go and solve questions again and they get it correct, the red underline will be erased. So every time you are reviewing a topic, you can see what your mistakes are in that topic so that you can target it. Another thing you can do is in the analysis and score prediction, when you go to study summary, this study summary, so I had USMLE step 1 here. I will change this now. I will turn it to anatomy and embryology. So now I've changed this. Now, the study summary is based on anatomy and embryology. It is telling me how I am performing compared to my peers, people with the same goal. And we also have specific recommendations on what I should be studying for my goal of anatomy. This is based on how many of the questions I have seen. So there are 9 questions that I didn't answer, 4 that I answered incorrectly. I didn't get anything correct or correct with hints. And this is an important topic. Cranial nerve palsy is very important for anatomy. So it's telling me that I should prioritize this. This order of priority is based on how important that topic is in that exam that I'm preparing for and how I'm performing personally. So this is how we use data analysis for individual students to track their own performance. And we also offer an upgraded product for faculty. So this is an extra thing. It's on top of your current Amboss subscription, if this is something you're interested in. We can enable the faculty to see this performance of all of the students. And you can give them assignments, specifically targeting whichever topic you are teaching. And you will be able to see their performance as group-based statistics, so everyone in the second year, for example, or a group A, B, C, D in second year separately. And you can track their performance and you can see if there is some common link, kind of like a curriculum gap analysis. So the way we use data analysis is this. Each student can individually understand from their own performance what they need to study so they can be more efficient with their time. But as an extra product, we have an educator tools, which we can offer you. If you'd like, we can have a presentation on this, which is on top of what you have, that will allow you to, at any time you want, go individually to see each of the students' performance, or as a group performance, or as an assignment-based performance, and things like this as well. Thank you.
Thank you, Fidan. I hope that has answered the question, Dewi. Yeah, I think that should conclude the end, actually, of my presentation for this specific product. Again, if you guys have any questions, we can ask now. We can troubleshoot this now as well, both for students and faculty. But if not, thank you so much, Terima kasih. Thank you for your attention, and we hope to see you soon. I will stay, I think myself and Dr. Fidan will stay on this call for a few minutes, just so if there are any other questions that want to be asked, we'll be happy to answer them.
Okay, thank you, Aisha and Kedan. It is interesting, and I think it is important for us to know, at least first of all, is how to assess both. Maybe some of our students and special for the new student. Maybe this is the new platform for them, so they need to learn about this, and also the refreshment for our previous student. Yeah. Thank you for the explanation, and also it is interesting, and I think there is some new features that we just knew today, and I think it is increasing the uh, the motivation, yeah, the motivation and the purposes for our student, and also the lecturers to use the Amboss. Uh, Miss Nuranzi, are you still in the forum? Miss Nuranzi? Okay, maybe she's still in another location. But
Oh, hello.
hello, yeah. I think the explanation is enough. Is
Mm-hmm.
complete enough. Is good enough.
Okay.
And the next is we need to discuss about our next program, yeah, next contract maybe for the next years, and also we need to analyze the usage of the
Yeah.
Amboss
Yes. Yes.
especially in faculty. Yes,
Yeah. We need. Yeah.
I'm with you.
Yeah. So we need to see this semester how it goes because we still have access until November. So let's make use the best. Let's make the best
Yeah, yeah.
out of this. Yeah. Okay.
Thank you.
Thank
Yeah.
you.
Yeah.
Thank you.
Doc
I think it's
Nurantia.
enough.
Thank you.
Thank you, everybody.
Yeah.
Thank you,
Dr.
Aisha. Thank you,
Eri.
Kidan.
Dr. Eri,
Yes.
make sure everyone is logging in and creating
Yeah.
creating their account. Yeah. Thank you.
Yeah. Okay. And I need this record, yeah. This record,
Yes,
so
it
I
is
can share
recorded.
this
Yeah.
to my
Yeah.
students. Yeah. Okay.
Yeah.
Thank you.
Yes. Okay. I'll
Thank you,
send you the
everybody.
recording. Okay. Thank you.
Recording stopped.
Thank
Bye
you.
bye.
Bye.
Thank you.
Bye.
Let's talk
Thank you, Aisha.
by email later on. Bye bye.